Hello, welcome to another video. I'm going to be talking about prostate enlargement or enlarged prostate. The other video I did was about prostate ultrasound scan. Uh, some people actually talked to me and said I should do something as regards, the cause of enlarged prostate and treatment modalities. So I'm just going to talk about that now. All right. Prostate enlargement, there's no known cause. All right. There's no known cause for an enlarged prostate. However, there are some factors that are considered when it comes to it. Number one, we talk of age. The age of the patient is actually something that we will need to take into consideration. As a man grows older, of course, certain things begin to happen, within the prostate. So we'll talk of age, talk of hormonal changes, all right, and then genetics. So genetics meaning that sometimes, if we're talking about familial history, so some members of the family actually have prostate enlargement. So that might actually mean that someone most likely, would have it too, because there's a family history of such. Now, hormonal changes. What are the things, hormones that can actually contribute to prostate enlargement? Well, men have testosterone, and then, there's a particular hormone that's culpable here. It's called DHT, dihydrotestosterone. Testosterone. So what this basically does is to stimulate the growth of the prostate gland. Testosterone is converted to DHT, dihydrotestosterone, and then this begins to have its effect, on the prostate gland. So there's also something as regards estrogen. Yes, you'll be amazed that men to have a level, but it's actually very, reduced. What's pronounced in the man is the testosterone. Okay, so age is a factor that needs to be considered, for enlarged prostate. So as one grows older, 50 years above, but once you approach 40, once you're 40 and above, just be doing your regular checks, concerning the prostate scan. So prostate enlargement, you could have BPH, benign prostatic hyperplasia on one end, and on the other hand, prostatic cancer. It will also be worthy of note that there's something called PSA, prostate specific antigen. It's a kind of protein, that's produced, by the prostate gland, and we get to see this in the blood. That's why we would ask patients to go do a check as regards PSA and come with the results. However, the PSA is not specific, for whether prostate enlargement, BPH, or prostate cancer. The other things that we do basically for people, just to be able to try to differentiate a little. I think I talked about prostate enlargement on ultrasound the other time. You can check my previous video on ultrasound. Um, the beauty about the ultrasound scan is that you're able to see the outline of the prostate well. It gives you an idea that, okay, this is likely a prostate enlargement case and not prostatic say cancer. Now, one of the things we also do is the doctor would wear gloves, do a digital rectal examination, but just stick, the hand into the anus, the rectum, then we'll try to feel the prostate gland, the outline, the surface of the prostate. So it may be a bit irregular. I know that's one of the ways we check. Now, a sample, can be taken from the prostate. Just take a little bit, from the prostate, and then we'll take to the lab. So, and the pathologists, the histopathologist will work on it. We'll check it under a microscope, and then will tell us whether there's cancer. Now, you know that prostate cancer, basically, once it's there, it has the propensity to actually spread, around the body. Let me talk about the symptoms that one may actually experience. Whoever is with prostate enlargement, it may actually come up with frequency. Frequency means that they get to go to the toilet, over and over. So there's frequency, there's urgency. You just feel a sense like, I need to get to the restroom, like right now. Then some people may actually come, by the time they want to urinate, they should just have this weak urinary stream, very weak. When they're trying to pass urine, it's usually weak. Now, some people, I find it very difficult. It takes time for them to, urinate. It takes time. And then it takes time for them to compose themselves. Now, apart from that, you could also see, something like dribbling. The urine can actually be dribbling. And the splitting, of the urine, that could also happen. So people come down with different kinds of symptoms, but if you come down with such symptoms, then it's best that you see your physician and let he or she, talk about it and do something about it. Been able to talk about course. Let me move on to treatment. How is prostate enlargement treated? Well, there are different modalities, different options. Number one I'll talk about is medication. Yeah, there are drugs. Okay. The first one I'll talk about is tamsulosin. Now, what this basically does is it helps to relax the muscles of the prostate, and also the neck of the prostate. That's basically so that the patient can be urinating regularly, and it can actually be easier for the patient to urinate. So tamsulosin. The other one is called finasteride. These are drugs that they use, the urologists use for patients, So what finasteride basically does is to block, production of DHT. And when that happens, helps with stoppage of, the gradual progression of stimulation of the prostate, and then in a way helps to cause shrinkage of the prostate. So two medications, basically tamsulosin, and then we talk about the finasteride. So these are medications basically that are given, to patients. All right, so I'll move on to the next one, minimally invasive, you know, um, you could call it therapy, you could call it surgery, but it's not basically, a big surgery like that. So there are like three things here. We'll talk about TURP, transurethral resection of prostate. Or basically, what that basically means is that an instrument will be introduced through the urethra, such that the physician, the doctor, will try to take a chunk around the prostate, and this would help to ease urination for the patient. The other two, we'll talk about TUNT, transurethral microwave therapy. Okay, the other one is TUNA, transurethral needle ablation. So these are minimally invasive, um, minimally invasive surgeries, you could call them. So the other thing that is done now is if that prostate is very big, you're having severe issues such that the patient can't even urinate at all, and then the doctor can decide to go for an open surgery, okay, such that we'll go in, we'll open up, and then we'll try to, in a way, debulk the prostate, okay, so that the patient can have ease of urination. Okay, so I've been able to talk about cause. There's no known cause for it. I've also been able to talk about the symptoms that one can actually experience, talked about frequency, urgency, and the likes. I've also been able to talk about treatment options. I've talked about, the drugs, medication. Talked about minimally invasive, surgeries. I've talked about a major surgery that can be done, open surgery. Now, let me not forget to also say that there are some things that you need to take note of. Just take a lot of fruits, vegetables, other things help, to slow the progression of prostate enlargement. You can either tone it down, I'm talking about red meat, or you stop it. Take other proteins instead of the red meat. All these things, if you do them, they'll help also to further stop or slow down the progression of prostate enlargement. And make sure that if you have a situation like this, please see your urologist. The urologist is the specialist. The specialist that's basically concerned, that specializes basically with the bladder, the prostate, big bladder. So let's do that. All right, so watch this video over and over again. If you've enjoyed it, please smash that like button. At least that's what they say, smash the like button. If you've enjoyed it, if you've not subscribed, please subscribe to this channel. All right, then you can share this video. You probably know someone that would need to watch this video again and again. So just share with people. And then there's a particular icon, the bell notification icon. Just click on it and, so that whenever videos come out, you can be shown that these videos are there. So whenever the videos come, then you'll be notified. All right, I hope you've enjoyed the video. Until I come your way next time, it's bye for now.